We are online and ready to go. Fundamentals of Massage, Theory Book, Chapter 20, Massage in Medicine. Siri's listening to me. Stop. A lot of this is review. Yay! So massage in medicine throughout history, we have allopathic medicine. So this is your pharmaceutical type, your doctors, okay? So this is mainstream medical practice using pharmacologic agents or physical interventions to treat or suppress disease or injury. So allopathic is not what we do. So this is doctors. Doctors, nurses, that section. And we are complementary and alternative. So in the U.S., 60s and 70s, massage started to reemerge again. So remember how it was thought badly because of prostitution, and now it's coming back full force as like a respectable profession outside of allopathic medicine. So now the doctors aren't having to do, or the PTs aren't having to do all the manual therapy, and massage therapists are getting their reputation back. So this is when the classic Swedish massage techniques was joined by other modalities. And then you got your reflexology, shiatsu, acupressure. Remember, that's digits, not needles. That's acupuncture and other alternative practices. So all the other modalities started becoming practiced, and we started shaping the massage world. Therapeutic modalities started emerging. I don't know what Reachian is, honestly. Rolfing, Traeger methods, the Alexander techniques. We can even throw in like lymphatic drainage, stuff like that started emerging. Alternative and complementary medicine. What's the difference? There isn't. So alternative medicine is a term that applies using services other than those usually received from your allopathic physicians. Complementary medicine is the term that took place of the term alternative medicine. So it is interchangeable. Does that make sense? So you can call yourself an alternative medicine provider, complementary medicine provider, whatever. Let's see. The establishment of the National Center of Complementary and Alternative Medicine was then generated to increase research for these modalities. So the complementary and alternative medicine modalities. So CAM would be complementary and alternative. So that's what that means when you see the word CAM therapies. So that's our therapies. So this is good for us, right? On page, bless you, 757, so 757 in your book, has a huge list of a bunch of CAM modalities. I wrote the ones that I think are more common on here, but you can, read the list, and if you don't know what something is, look it up, right? That's fun to learn, isn't it? Woohoo! We're so happy. All right, acupuncture is a CAM modality, even though it is provided by a doctor of acupuncture. I don't know what they're called. Acupuncturist, right? Aromatherapy is considered a CAM modality. Any Ayurvedic therapies, a lot of it is India-rooted. Chinese herbal medicine, chiropractic care falls in this category. Color therapy, guided imagery, hypnosis, massage, obviously, meditation, Reiki, sound therapy, and there's so many other complementary medicine modalities. Super cool stuff. Some of it is as simple as like journaling or whatever. Other terms. So the term complementary and alternative medicine was created in 1998. So it's not really that old of a term. It was created by the National Institute of Health, the NIH. It's not called the NIH. So holistic, when you see the word holistic, we're talking about looking at something as a whole, right? So this is spiritual, physical, emotional, social, environmental well-being. Mind-body therapies would be like positive reinforcement, positive attitude. Like they tell you, oh, don't say anything negative because that's what you're putting out in the universe. So positivity, right? Hypnosis, guided imagery, meditation, Tai Chi, that shouldn't be 2 words. Yoga could be a mind-body therapy. Holla! Integrated medicine is exactly what it sounds like. It integrates multiple things, so it combines complementary and alternative medicine with allopathic. So when you see integrated medicine, we're talking about maybe massage and physical therapy, or massage and I don't know, your orthopedic doctor combining therapies to, help you out holistically. And I would say, like, even therapy, mental care would fall under these categories. Mental health. Integrative medicine. So some doctors might put a client or a patient in their terms on an integrative program and combine several different medicines together. So you can have conventional medications. So they might try, this is a good one for mental health, they might try an SSRI for you. Maybe while doing therapy and telling you to do positive imagery or massage or meditation. So we're combining, right? Herbal supplements, diagnostic medical screenings. There could be some aspects of oriental medicine, acupuncture, PT, nutrition, diet, exercise assessments, mind-body interventions, massage, art and music therapy, yoga and meditation. So tons. I actually have a client who, she actually is ultrasound tech, but before that she used to do music therapy. Like, that is so cool. She's like, there's just not a business for it. So, if you know anybody who does do cool things like that, give them the business, because that's very rare to find. Each care plan is tailored to fit each person's specific needs. All right, massage and integrative medicine. So massage is usually the first choice for patients that are in an integrative medicine program. Hold on, I gotta wet my whistle. Massage could be a patient request. It could be suggested from a team coordinator or a prescription from a physician. Whatever the reasoning is and how they came to you, just take care of them, right? And then also remember, if you're sharing health information between 2 parties, you need a consent form signed by your client saying that you can talk to their doctor or physical therapist about the treatments, because you're not allowed to do that without that signed consent. If you were to bill insurance, you probably won't, because I don't know anybody who can bill insurance in Ohio as a private massage therapist. Now, if you're working under a doctor, I tried to become a provider through like Anthem and all those during COVID, and they said, oh, we don't, unless you're working under a physician, you can't bill insurance, whatever. So if you were, say we could bill insurance, you need a prescription for massage in order to do it anyhow. So anybody off the street who just decided that their neck hurts and they want a massage and then they want to bill insurance, cannot do that. So a lot of times what I'll tell people is if you have a health savings account card and it works on my end, we're good. You can use that because it's their own money they're putting in there. A lot of times I'll tell people I can print off SOAP notes or session notes or invoices if you need, and you can try to submit this with your insurance. So that's the best that we can do in Ohio. I'm not sure what the West Virginia law is, if they can bill insurance or not. I should look into that. Make myself a note. West Virginia LMT, bill insurance. Welcome. All right, working in an integrative clinic. There's not a whole lot of, I'll call it a wellness clinic. A whole lot of wellness clinics out in the rural part of Ohio. You technically have to go to a bigger city to be involved in some of these organizations. But if you were to find an integrative clinic, helps therapists become, it'll help you actually be more knowledgeable of other therapies. So that's why I've worked in PT environments and chiropractic environments, and I think that background was very good for learning about what goes on in those clinics. And it makes you a very well-rounded massage therapist if you've had several different experiences professionally. There might be guidelines or protocols that each CAM clinic might have established in certain services. So a lot of times you're maybe not going to have your own menu. They're going to kind of tell you what you can do. A lot of times it'll be, and we're going to go over units here in a little bit. A lot of times it's not even a full hour full body massage. It's like a spot treatment type thing. So integrative clinics are routinely reviewed by the Joint Commission on Accreditation in Healthcare Organization. So this JCAHO, we'll call it. Let's just pronounce the abbreviated words. JCAHO. Before they can be accredited, this organization needs to come through and check boxes for you and accredit that specific clinic, okay? A therapist must show knowledge of the particular department. So say you're in the birthing center, you have to have a knowledge of birth and pregnancy, prenatal, postnatal, all right? Or sports medicine or oncology. So typically you're going to want to know more about what's going on in that department. Which, there's my other example. I've talked about how I worked for a hip specialist up in the Cleveland area, and that's where I learned a lot of my detailed hip stuff from her. So that was awesome, just to see her approach on trying to balance like sacral and like the pelvis issue. All right, so last on the list, you might be required to complete specific documentation. It might be in SOAP note form. It might be in whatever that office form is that they want you to do it in. So there's probably training if it's not SOAP note form. Keeping records, whether it's SOAP note or whatever documentation procedure they have. Typically, it should have all of these, the assessment, the type of massage that is given, the effects of the massage, so see how most of this is SOAP note anyhow, physical observations, and follow-up recommendations. So this is usually what is in your documentation. And you might be required to work with certain populations and have additional training. Like I said before, pre- and postnatal, infant massage training, oncology, post-surgical, massage for the critically ill, and so on. Medical massage. So medical massage is basically your massage that you're doing, your therapeutic massage, but prescribed by a doctor. So that's what the difference is. If you want, when you go out and get your license, your menu could state just medical massage. It'll keep away a lot of the creepers, and people might take you more serious. You can take whatever approach you want, whether you want to do it more medically or if you want to do it more spa-like, whatever your goals are for what you want to do. Just know that if there is a medical massage, typically there's a prescription for it, right? Let's see, where am I at? This massage might take place literally in the hospital if you work there, medical centers. But a lot of times it occurs at the massage therapist's space, whether that's an office or a studio or wherever they're doing the work out of. Some massage therapists do home visits. If you do medical massage, make sure you have a good knowledge of pathologies. This is why we're learning about diseases and dysfunctions of the body. It just helps you to treat the client safely and more effectively. And then for the medical massage, it is therapeutic massage, so it also includes all the modalities you have learned. So you're just taking all of your knowledge in the alternative medicine world and creating like the perfect customized plan for that individual client. So that's kind of like end goal anyhow for massage, unless you want to work at like a spa that just busts out like relaxation massages. Whatever you feel like doing. Maybe that's your jive. Yeah, that's your thing. You're jiving with it. All right, insurance reimbursements. If you were to work somewhere where you can get reimbursed for insurance, and this is also, we'll talk about being a VA provider, which it doesn't say anything in the book, and I need to actually update this. I'm in the process of my clinic being a VA provider for veterans for massage. It's a very long process, but what typically happens, and it's kind of the same with workers' comp. We'll have a couple slides of that. We complete the amount of massages that we're allotted for this person, and then we submit it to get paid. So think of that as insurance reimbursement, but through the VA or workman's comp, which if you were to do VA or workman's comp, there's a lengthy process and application and things you have to do in order to become a provider for those. Pros. It may be rewarding to help relieve this person's pain. It should always be rewarding. Massage is now available to a client that maybe couldn't financially afford it. So a lot of times, if you are going to work with a chiropractor where they bill insurance for your massage, you're probably going to get booked more often because people, this is expensive. Massages aren't cheap. So you're going to get the people who maybe can't afford it without their insurance, right? Which that happens. I used to work for like a wellness clinic before they closed down. COVID shut the doors hard on that company. And I was just starting my own business, so it gave me like that opportunity to be like, Bridget, go full time. So COVID was a blessing for me, as much as it sucked for everybody. And I had 8 weeks off. But I noticed a change in clientele is where I'm getting. So I had all kinds of people with insurance, and then people that would come to me every single week. I no longer take them because they can't afford me. So it's a big difference. Cons. So those are your pros. Cons, typically there's more paperwork, more documentation. You need to have proof, okay, that you've done these massages, or you don't get paid. All right. Payments may be denied or reduced. So maybe you're saying my massages for workman's comp are $100 an hour. We'll just say that's just a nice even number. They might be like, I'll give you 80 for each massage. So they will negotiate the price a lot of times, kind of like insurance companies do. Payments can be delayed months or sometimes years. Sometimes if you're working workman's comp case that isn't being closed, you might not get paid until that case is closed. So that's also why I stopped doing workman's comp. One time it took me like 3 months to get paid. I'm like, nah, I'm good. So I took myself off the list. But if you can afford to do that and, not take a check and wait it out, it's actually a really good thing to sign up for so that you have that steady clientele. Just know that payments are delayed until after your treatment. If any of the paperwork is wrong, they deny it, tell you to fix the paperwork, and then you have to resubmit it again. So that could delay your payment process as well. Insurance providers and coverage. So most insurance providers do not reimburse private massage therapists for services provided to clients. Reimbursements usually billed by medical facility as manual therapy. So it's not billed as massage a lot of times. And typically we have to be working under a physician, physical therapist, chiropractor, etc. And then this is constantly changing, Medicaid and Medicare. But typically, I still think as of now, they do not cover massage services. So people who have Medicaid and Medicare as insurance aren't allowed to get free massages, which those might be the people who need it the most. So our system's broken. Filing a claim. So typically there's verification and authorization for claims. There's something called a current procedural terminology code, so a CPT code. These are the most common codes for us if we were working under, a physician where we can bill. Typically they're going to have a billing department doing all of this for you. But it wouldn't hurt to kind of be familiar with some of these codes. There's a code for doing a hot or cold pack. So hydrotherapy, right? You can bill for putting hot or cold on somebody. Then there's the massage therapy code, 97124, and the manual therapy code. So I believe when we do workman's comp, we do use this massage code up here, right? It's been so long since I did it that I can't remember. Did you? See, she's the perfect,
not in massage,
but in general. So you had to deal with CPT codes all the time.
Everybody wants to know what they are.
Yeah, and if you get them wrong, you got to refill it out.
And truly months to years if stuff is not correct.
Yeah,
And
it's
there
frustrating.
And there is a time limit on how long you can go back and correct stuff, so you want to make sure you're staying on top of stuff.
Yeah, Rose, you just did that all for free, or the company you're working for. Nobody likes to do that. We've got to pay our bills. So verification for filing a claim would include the client or the patient's name, the name of the policy holder. So maybe they have Anthem. Anthem would be up there. Maybe Bob is the insurance holder for his wife, Mary. So Mary's our client. Bob is the guy that has the insurance through his work. The insurance company is Anthem, right? And then you would have the adjuster's name and phone number on here. Insurance ID number. A lot of times it could also be social security number. Whatever documentation they want you to provide, right? The claim number. There usually is a claim number involved, so they can look you up easier, right? The date of the injury or the incident needs to be on there as well. So when they bill insurance, they're billing per unit. Like I said, you're typically not doing an hour massage. So one unit can last minimum 8 minutes, maximum 15 minutes. So I've worked for places where it's literally an 8-minute massage. I go in there, work on that area, over clothes even. Loosen that area for the doctor to do the adjustment or to do the physical therapy or whatever. I've also worked at places where they really extend it and do the 15. So it just depends on time frame and if they feel like raking the insurance over the coals or not. So now, say I were to do a half-hour session, they can bill 2 units, or they can bill 4 units, depending on what their unit is, right? So 2 units would be the 15 minutes. 8 times 4, nope, that's wrong. 8 times 3. So they can do 3 or 2. Got it? Good grief. Here's good old workman's comp. So if you want to become a workman's comp provider, you have to apply to become a BWC provider. And it's not on here, but there is something called an NPI number, National Provider Identification Number. You need to have one of those before you become a workman's comp provider and a VA provider. So it's just like a code number verifying you're legit, basically.
The application process.
That application is so annoying.
It's awful.
I hate it. So you have to apply. There must be a prescription for massage therapy or specific CPT codes, right? The prescription usually has the number of treatments and the time frame. There's always a time frame, especially workman's comp. So what happens is maybe Mary hurt herself at work, right? And she's doing PT, had surgery, whatever. She got pins in her ankle. So she's trying to do massage therapy through workman's comp. They allotted her 10 sessions, but these 10 sessions must be completed in 5 weeks. So whether you only get 2 sessions in 5 weeks or 10, you can only bill up to 10 sessions, and it has to be, there's a date where it ends that you have to not go past. A lot of times what I've done in the past for people is I make them sign something that if you don't show for your appointment, you are paying for it out of pocket. Because if they don't show, you're not getting paid through workman's comp. So you have to, be kind of strict with that. Because sometimes they're like, whatever, it's free, and they just don't show up. And whatever. Well, that's somebody's time slot that you're taking up, and you're rude. So, yeah. A lot of times after the 5 weeks or the 10 sessions after this is concluded, right, you can go ahead and they can request more sessions. And sometimes if somebody has a chronic issue, I used to work on a firefighter who had forever workman's comp cases. So they would just renew him some more when that was over. But usually it took, about a month or 2 for that to go through again. So he would have a little lapse in service. And they always want SOAP notes. So they always want proof of what happened. And you cannot work, say Mary goes in because she needs massage on her leg. You cannot work anything else. If you put, she's complaining of headaches today. They don't care. She's not there for her headaches. She's there for the issue or the injury that put her in this situation to begin with. So be careful with documentation if you're working on workman's comp, insurance, or VA, that you are only allowed to work on it and only allowed to document what is prescribed. Make sense? Over and out.